TPAPN and Safe Harbor, presented by John Donato and Brianna Sen. Texas Board of Nursing. Before breaking down TPAPN and Safe Harbor, it's helpful to note that they are both supported by or in conjunction with the Texas Board of Nursing. As such, their purpose is to safeguard the public and support nurses. On the next slide is the mission statement of the TBON, which just reinforces the spirit behind their programs and resources. The mission of the Texas Board of Nursing is to protect and promote the welfare of the people of Texas by ensuring that each person holding a license as a nurse in the state of Texas is competent to practice safely. It is also the individual nurse's responsibility to practice safely and take initiative when available. Therefore, TPAPN and Safe Harbor function best when we are active participants and utilize these resources or contribute to them to help ensure the safety of the public. Here we've included TPAPN's objectives, which include to promote patient safety through a program that provides early identification, support, and monitoring for nurses who may be unsafe to practice due to substance abuse and/or mental health conditions or related incidents. To develop and maintain a list of appropriate treatment centers throughout the U.S. for nurses referred to TPAPN, and to develop and maintain a list of approved mental health and substance use evaluators and recovery support services available in Texas. I don't think I'm going to read them all to you guys, but it's definitely good to know why they exist and what their objectives are. In their handbook, TPAPN said that their vision for the program was a future where referral to TPAPN is seen as an act of compassion and a desire to help. They said, we want participation in TPAPN to be celebrated as an opportunity for recovery for the benefit of the nurse, the community, the profession, and the public. TPAPN is a program by the Texas Nurses Association in cooperation with the Texas Board of Nursing. We opted to put in this graphic to show you how TPAPN works. So this is just a little flow chart. It shows, of course it starts with a nurse experiencing substance abuse or mental health events. And then they are referred to or ordered to TPAPN. And this can be in the form of a self-referral if a nurse realizes that they're having an issue and want to take actions to get help before something bad happens as a result of a mental health issue or substance abuse problem. Then their needs are determined. This is usually done by a therapist, or they'll just get a general case overview. And then they may be drug tested and have a mental health assessment done. So they'll be diagnosed, have treatment recommendations, and then be given recovery support recommendations. And then TPAPN will determine if they are fit to practice and if they need to be monitored while practicing. Now this is it is a voluntary program, but once you're in the program, they do require certain things of you, which we'll get into that here in a little bit. And then you'll either be adherent or non-adherent. And now we're going to see how that works. Here's a little matrix overview. So there's two different tracks, one for substance abuse and one for co-occurring, and then one for mental health conditions. You can have mental health conditions with substance use, obviously, and if that's the case, then you're going to be on the track that's for substance abuse, though. This kind of gives you descriptions of their tracks and tiers and how they work. So it's a nice little slide if you're seeking to understand what exactly is required of them and just in general how it works. Over here is once you're done with TPAPN and if they were non-adherent. So that's a nice little thing for you to be able to read. Substance abuse in nursing. The American Nurses Association estimates that 6 to 8% of nurses use alcohol or drugs to an extent that is sufficient to impair professional performance. Others estimate that nurses generally misuse drugs and alcohol at nearly the same rate, which is 10 to 15%, as the rest of the population. Only about 1/3 of 1% of all actively licensed nurses are sanctioned each year for their conduct. So that's a pretty big disparity in between what's estimated that nurses are abusing substances and then which ones are actually being caught. The American Association of Nurse Anesthetists report that the addiction rate among anesthesiologists and nurse anesthetists exceeds 15%. So, I mean, this slide just highlights that even though we are healthcare professionals, that we are still just as likely to have problems as the rest of the population. And so TPAPN really is a valuable resource because it can help us get treatment and return to practice safely. Here are some behaviors that are consistent with substance abuse. So if you identify these in yourself or maybe another nurse, then you may be able to suspect that they may have a drug problem. So they may have the smell of alcohol on their breath. Or maybe they frequently use strong mouthwashes or mints to cover up the smell of alcohol on their breath. They may have mood swings, irritability, bloodshot eyes. They may neglect their appearance, have impaired coordination, excessive use of sick days, or maybe excessive use of short breaks or leaving early, especially if this is on like Fridays or Mondays. And then the nurses, clients may complain of not receiving their medications. Obviously, this would be like if the client was prescribed a drug that is able to be abused and there's record of the nurse having given it, but then the client is claiming that they didn't receive it. Or the nurse may forget to get another nurse to witness wasting. Obviously, one occurrence of any of these things doesn't necessarily highlight a substance abuse issue, but whenever you start seeing a pattern, then you may be able to suspect it. So, is participation mandatory in TPAPN? Well, the program is voluntary, so in order for it to have a positive outcome for nurses, the nurse must be able to commit to TPAPN and its process. However, TPAPN is required to report to the nurse's employer and BON if the nurse is non-compliant, has a positive drug screen, or withdraws from the program or moves out of state. But if the nurse is a self-report, TPAPN will only report the nurse to the Board of Nursing if it is determined that the nurse may be an immediate threat to themselves or others. So what's required of participants? Well, nurses participating in TPAPN must inform their employers of their participation in the program prior to accepting a position. They may be asked to attend self-help meetings and to follow recommendations of their therapist. Keep up with daily check-ins. Usually that's with an accountability partner that they would be talking to. Take random toxicology screenings or even refrain from nursing or to practice with restrictions. So here are the potential nursing restrictions that could be placed on a nurse who has impaired practice but is going through the TPAPN program. They may have narcotic restrictions, usually that's about 6 months. May not be able to be on call, may not have shifts longer than 12 hours, will be regularly assigned predetermined unit, so floating would be restricted here. The nurse may be asked to be employed in only one facility by one employer. They will not be able to practice any sort of nursing that's self-employment based. They may not work with staffing or temporary agencies, or hospice or home health. And they may have no more than 96 hours of work per 2-week period. And then a single worksite nursing practice only. Exceptions are on a case-by-case basis and require the TPAPN and Board of Nursing approval. So one thing that we might be thinking is, do these accountability programs even work? And this information comes from the NCBI, and it was a study that they did, and they said that mutual support programs are readily available, and the important question is whether or not they work and are effective in achieving their goal of members becoming alcohol and drug free. Each of the 3 main 12-step programs conducts periodic surveys of its members to assess demographic characteristics and to determine the length of its members' abstinence. The median length of abstinence reported by Alcoholics Anonymous and Narcotics Anonymous is greater than 5 years, with roughly 1/3 of each of the 3 groups having between 1 and 5 years of abstinence. Respondents reported attending on average 2 to 4 meetings per week, and these findings, given the caveats about simple representativeness and the correlative nature of the results, suggests that longer-term abstinence is achievable and sustainable among those with relative regular meeting attendance. The reason I added this information is because TPAPN utilizes groups like Alcoholics Anonymous and Narcotics Anonymous, and they have a lot of similar structure. And the fact that you have an accountability partner, you have check-ins, they ask you to do these things on a regular basis. And so, this just shows that it does work whenever you're committed to the process. How does TPAPN affect me if I have no substance abuse or mental issues? Well, first, I have a link for you to listen to about accountability and what that means for us if we have no issues or if we're self-reporting. And if we have no issues, you may be able to volunteer with TPAPN and give back into our community and the nursing practice. And you can also obtain certifications that help in this practice through TPAPN. They give you a lot of good and valuable resources. And then also the simple fact that if you take initiative to participate in TPAPN as a volunteer or as an accountability partner, well, that's a way to grow leadership skills, which is something that's really valuable depending on where you want to go in your nursing career. So when you do watch this video, just watch up to 20 minutes and 40 seconds. It's time-stamped to begin somewhere around 19 minutes, so it's not a very long section of the video. Now that we've gone over what TPAPN is and how it works, I wanted to go over some of those key points we talked about earlier on their website, just so we can get a better idea about how those apply. So the first thing I want to take note of is how simple their homepage is. It just gives you a quick about TPAPN and then all the relevant links that you may need immediately. I think the reason it's so simple is because it's not only designed for those of us who may want to get involved and apply to be a volunteer or even to refer another nurse, but sometimes nurses exercise that accountability we talked about earlier in referring themselves, and they may be in a state of crisis. Also, I'm sure this is a very difficult process if you are self-reporting, and so I believe that's part of why they just keep it so simple and easy to find your way around. On the bottom right hand side of all of the pages, they have the National Suicide Prevention Lifeline phone number and the Veterans Crisis Line number as well. So Just go back to that page. And then right here, easily available, is the TPAPN referral form. This is what you would fill out to either refer yourself or another nurse to. And in this box is where you would enter the information just leading to the referral. And as you can see, you can fill it out online, which is very convenient. And it's only a short 2-page application. And the second page is just an extension of the first to be able to type in that extra information about the circumstances that may have led to this referral. Remember, referring another nurse, while it is very serious, it is also required if you know or suspect that they may be having a substance abuse or mental impairment that is keeping them from practicing safely. Examples of this would be perhaps you see a nurse that should be wasting medication and instead they're keeping them. Or maybe a nurse is coming to work clearly under the influence. And those are just a couple of reasons which may lead you to having to fill out one of these forms. Now going back to the home page, there's another form that I wanted to point you to, and that is the Peer Support Partner application. It is right below the referral form. The first thing you'll see on this application is their overview and the information about what TPAPN is, briefly. There are some valuable hyperlinks that you can follow to read further about them, including the tpapn.org. When we scroll down, it explains to us what the guidelines are for being a peer support partner. The only real requirement, though, is that we have a valid Texas nursing license. Everything else is mostly just preferred but not required. They are always needing peer support partners. One important thing, though, is that you have strong interpersonal skills, because you are acting as an accountability partner as well. And so your peer support partner has to be able to trust you and have a sense of an ability to confide in and speak to you. And I know I say trust, and then when you look at the peer support partner responsibilities, it's to notify the TPAPN of the participant failing to maintain contact with you, or if they have a relapse, suicidal threat, or mental health symptoms. However, they are aware of this when you enter into this peer support partner relationship, and it's not so much tattling as it is just helping keep them accountable for their actions and choices. And remember, this program is an alternative to discipline, and so it's really preferable that they complete this program so that they can document a safe return to their nursing practice. So all you do is scroll down and complete the two-page support partner application. It's very short and concise. And then there's one other thing that I would like to show you, and that is underneath Peer Support Partners, Training Resources. These training resources are not required, but you may very well be interested in them. You do not need a certification. However, if you find yourself wanting to look into them, I think that they can be very beneficial for your practice, particularly if you are interested in mental health nursing or remaining a part of the Texas Peer Assistance Program for nurses, because this is not really something that we gain from. It's all about
kind of giving back into the nursing profession in our community, and we'll do a better job if we have more education on the subject matter. Now, if we follow one of these links, it brings us to the home page of that certification so that we can look into starting to get that certification. It tells us all about it, eligibility requirements and application requirements, along with the fees and renewals. Of course, each page is different, but they're all very similar. And the fact that it just brings you straight to what you need to begin working towards those certifications. The last point that I had started talking about and mentioned in the previous slide was taking initiative and becoming a leader. I know that being a peer support partner may not garner us the public gratitude or the public recognition that we may be looking for. However, it does help us begin to foster and grow those leadership qualities that you really need to be a good leader. Because leadership is more than telling people what to do or being a charge nurse. It's about setting an example. It's about empowering those that we want to lead to meet goals. And this is a very powerful way that we can begin down that path to become not only the leader that employers would like to see, but that other nurses would like to see as well. And that's a reliable and generous and empathetic leader. Well, that's all that I really had to show for the Texas Peer Assistance Program for Nurses. And then we'll be moving on to Safe Harbor.
So, Safe Harbor, what is it exactly? Safe Harbor is a process that protects a nurse from discipline from the BON and the nurse's employer as well. An employer cannot retaliate, suspend, terminate, discipline, or discriminate against a nurse that invokes Safe Harbor in good faith. If the nurse is asked to do something that they believe is in violation of the nurse's duty to a patient and/or could result in a violation of the nurse's practice or of the Nurse Practice Act or the board rules, the nurse may request a Safe Harbor peer review to determine if the requested conduct is in violation of the nurse's duty. So, how would you invoke Safe Harbor if you felt you needed to use it? Safe Harbor must be invoked prior to engaging in the conduct or assignment that was asked of the nurse. The nurse must notify the supervisor that requested the conduct or assignment specifically, in writing, that they are invoking Safe Harbor. The contents must meet the requirements of a Safe Harbor quick request. If time does not permit the nurse to put the invocation in writing, the nurse may orally invoke Safe Harbor to the supervisor. The supervisor must then record in writing the requirements for Safe Harbor quick request. A nurse invoking Safe Harbor due to a physician's order must follow the same rules they would for the supervisor's request. Before the nurse leaves work, they must write out a detailed written account of the Safe Harbor invocation that meets the requirements of a comprehensive written request for Safe Harbor nursing peer review. So, they write out a quick request, but before you leave work, you have to complete all of the paperwork required for it to be fully invoked. So, engaging in conduct under Safe Harbor protection. When the nurse invokes Safe Harbor, they may engage in the conduct or assignment requested of them while awaiting peer review unless the conduct or assignment is unprofessional or criminal or is beyond the nurse's scope of practice. So, refusing to engage in conduct under Safe Harbor. So, say you did Safe Harbor, but you still don't want to do whatever the assignment is. So when a nurse invokes Safe Harbor, they may refuse an assignment they feel is unsafe or outside their scope of practice. Keep in mind, if a nurse chooses to refuse an assignment under Safe Harbor, and then peer review determines that the assignment was appropriate, the nurse may then be punished according to the discretion of the facility where the offense happened. So, if you decide not to do it and they decide that you should have done it, then you can still get in trouble. So say they want to assign you 4 patients, but you don't want 4 patients today, so you try and invoke Safe Harbor. If they deem it was safe for you to have 4 patients anyway, then you can definitely still get in trouble for that. So when would you invoke safe harbor? So I got a few examples down here for you to keep in mind. So if a supervisor asks you to care for more patients than you feel comfortable with, for example, a nursing supervisor asks you to care for 12 patients without assistance from an LVN or even a PCT, you can see how, that'll get a little bit overwhelming for you. You got all these people to take care of, you got to document for them. It would be hard to keep track of everybody, all 12 of those patients. So that would be an example of a dangerous situation where you could definitely invoke safe harbor. So another example, a doctor prescribes something that you think could harm the patient. However, the doctor insists on the patient receiving the medications. For example, a doctor orders 40 milligrams of Lasix IV push stat for a patient with a potassium level of 2.8 and a blood pressure of 80/30. You tell the doctor it would be unsafe to administer the Lasix to this patient, but they tell you to do it anyway. So as you can imagine, that would lower their potassium more, it'll tank their blood pressure even more, they could die from that. So you would want to invoke safe harbor in that situation. A nurse can invoke safe harbor anytime that they feel an assignment or conduct asked of them could be unsafe. And we have a YouTube video here, and it's kind of funny, I guess. It's a little parody of a popular song that was popular, a few years back. So maybe you'll get a little bit of enjoyment out of it. So in conclusion, TPAPN is needed in the medical field because healthcare providers are only human. Giving nurses a chance to rehabilitate from alcohol, substance abuse protects both the nurse's future in healthcare and the future patient's safety and health. Safe harbor is important because nurses need to be able to protect themselves in order to do something they don't think is right. Without it, all the blame for whatever happens would probably be shifted directly onto you, the nurse.
And here's our citation page.